Okay, hi, it's Dr. Buford. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything's magnified 30 or 40 times on the screen, and here's a blue cannula coming in the front. I'm going to start by looking at everything except the bicep. So to the left here, that's the superior edge of the subscapularis tendon. There's usually a ligament. Give me like a crochet hook or something like that. There's usually one of the anterior glenohumeral ligaments crossing it. Usually the middle glenohumeral ligament crosses it right down in this region, and there's really not much of a middle glenohumeral ligament here, maybe a little wisp there even, but not much. The actual tendon of the subscap is this strong edge right here. So this is subscap right here. We can tug on it and make sure that it's not loose. Pull the cannula back just a little bit, and then as we push on the subscap, You're good, you're good, you're good. As we push on the subscap here, we can see that that's inserting normally. Now we'll look down the front of the shoulder. We tested your shoulder before we started, and there was no instability. A little bit of labral fraying, but not too bad here. Again, I'm just trying to focus just a little bit better. There we go. So a little bit of labral fraying, but not too bad. And then as we look at the back of the shoulder, posterior labrum looks good. Again, a little bit of roughness in the glenoid articular cartilage. Posterior capsule looks good here. We'll come back and we'll look at the rotator cuff, or at least the supraspinatus portion of the cuff. And this is it here. We've already got a little hint of the abnormal biceps anatomy, but like I said, we'll get to that in a minute. So here's the rotator cuff, the supraspinatus portion. That looks great. And here's the interesting part of your biceps tendon. Your biceps is inserting into the rotator cuff, and that's not typical. I won't say it's abnormal because it's been described and we've seen it before. Some people call it a BARC, B-A-R-C, complex, biceps attached to rotator cuff. And so that's not normal, and that's probably why your MRI scan was read as having potential superior biceps issue, because it doesn't attach down here. There's a little bit of a wispy strand, see right here, that kind of heads this way, and that can certainly look like a tear on an MRI scan, but this is the issue here. As we tug on it, you can see it starts to become a kind of a rope again as you get up high. As we tug down, I see how it starts to look more normal. Let me rotate the camera here. It starts to look more normal as it exits the joint. Now, we also know you've got some biceps issues outside the joint, and we'll deal with that in just a little bit. But this is an interesting picture showing the BARC complex, okay? Okay. So here you can see we've actually released that biceps tendon. So it's exiting the joint out there. We're going to do a tenodesis in a minute. But the biceps is now outside. What's left of this BARC complex is right here. Okay? So that's a pretty good idea, a pretty good picture showing how it was inserting into the rotator cuff. We're going to go ahead and take that now. So we're just taking away a little bit of the stump so it doesn't cause any problems. That's all. And that's really it, okay? Okay, so now we're going to go look above the rotator cuff. Okay, so we're in the subacromial space. The camera's coming in, switch them out. This camera's coming in from the back. Blue cannula's coming in from the front. And we're just having a look to see if we need to do a decompression at all. One of the ways we can evaluate that is we can look at the undersurface of the coracoacromial ligament and see if there's any signs of impingement, because that's where it would show up. Right now we're just getting a little bit of hemostasis here, stopping the bleeding a little bit. Okay, and so now the coracoacromial ligament is on the right side of this blue cannula, right above it here. You can see the fibers running there. And I really don't see any significant fraying in it. That looks pretty good. So at least on first look, it doesn't look like we're going to have to do anything to that.